This video is meant to introduce you to the CDC STEADI Fall Risk Assessment and Interventions. Why do we care so much about falls? According to the CDC, 2.8 million older people are treated in the emergency department for fall injuries, and every 20 minutes an older adult dies from a fall in the United States. The Centers for Disease Control has developed the STEADI program, which stands for Stopping Elderly Accidents, Deaths, and Injuries. The goal of this program is to increase awareness of fall risks and prevent falls when possible. The resources developed for the STEADI program are for patients and clinicians. This algorithm represents a systematic approach to identify fall risk and address falls and strategies to reduce risks of future falls. The STEADI Stay Independent brochure contains a fall risk self-assessment. A yes response to 4 or more of the statements indicates increased fall risk. Have you fallen in the past year? Are you worried about falling? Do you feel unsteady when walking or standing? If patient answers yes to any of these questions or scored more than 4 on the Stay Independent brochure risk self-assessment, patient is at risk of fall. If there has not been a fall in the last year, the patient should be educated regarding risk reduction and the value of maintaining physical activity. Vitamin D supplementation should be considered. Recognition of home safety risks is also needed. The STEADI resource Check for Safety is helpful for this. Additionally, consider referrals to PT and/or community programs. Tai Chi, a form of slow movement exercise that emphasizes balance, is an excellent choice. Research evidence confirms effectiveness in reducing fall risk in older adults. If a history of falls or an increased risk of falls has been identified, a performance-based assessment is recommended. The Short Physical Performance Battery, also known as the SPPB, is an evidence-based 3-step assessment that can be performed in a clinic or home setting in 10 minutes or less. The SPPB has 3 components: balance assessment, gait speed assessment, and the chair stand assessment. The SPPB total score predicts future disability. If the performance-based assessment was completed successfully, fall risk assessment and prevention strategies as well as maintenance of physical activity should be emphasized. If the patient does not perform well on the assessment, further assessment plus referral is needed. A key question is to quantify the number of falls in the last year. If there has been a fall in the last year, a multifactorial assessment is needed. Understanding the circumstances of the last fall is the first step. Additional factors and elements are listed here. An important part of the physical assessment is screening for orthostatic blood pressure changes. The STEADI resources recommend the following steps to check for postural hypotension. First, have patient lie down for 5 minutes. Then take blood pressure and heart rate. Instruct the patient to stand with close contact guard. Take blood pressure and heart rate after 1 minute of standing, then repeat blood pressure and heart rate after 3 minutes of standing. The clinician needs to respond to issues found during the in-depth screening. For example, discuss and explore home hazards such as clutter, pets, stairs, throw rugs, bathroom safety, poor lighting. Address postural hypertension if present. Address polypharmacy concerns, and eliminate meds if possible. The STEADI Check for Safety brochure is a helpful resource for home safety assessment. This is a clinical tool from the CDC STEADI Resource Library designed to help determine fall risk. The notes column shown here offers examples of the parts of the fall risk checklist that are addressed in the health risk assessment and in the annual wellness visit assessments. Examples include the 3 fall history questions, cognitive impairment assessments via the MiniCog, the Incontinence Impact Questionnaire 7, and the PHQ-2 for depression screening, foot assessment, medication review, vision testing, including contrast testing, and additional vital sign screening such as orthostatic blood pressure check.